The late 1930s was a time of hardship and turmoil for the community of Baldwin, Wisconsin. Unemployment was at an all-time high as St. Croix County was experiencing a major drought. Since Baldwin, a village of 800 people at the time, was primarily a farming community, the drought caused financial hardships for many. But thanks to the generosity of a local farmer, Baldwin was about to get a community hospital. Since the village of Baldwin was formed in 1871, the community dreamed of a hospital. In 1921, right after the Great Flu epidemic, Mrs. Jessie Corberstein from Hudson bought the former N.B. Bailey home and turned it into a hospital. This hospital was primarily used to house patients for surgeries. The nearest hospital was in Eau Claire, nearly an hour away, an hour which could mean life or death for Baldwin's early residents. On October 10, 1935, 85-year-old Anton Bergslein breathed his last breath. It was his dream for Baldwin to have a community hospital. In his will, he left $20,000 to the village of Baldwin to build a community hospital. The newspaper from the time describes Mr. Bergslein as a man who was always industrious, thrifty, religious, and well-liked by his fellow men. Now, Mr. Bergslein left very strict procedures on how the building would take place. He stipulated that $18,000 was to be used to build a brick facility, and $2,000 was to be set aside for maintenance of that facility. He appointed Dr. B. Cunney, Arnold Willink, and George B. Hebink as trustees of the will, with instructions that construction would begin within 2 years of his death. Other instructions were that the hospital must remain not-for-profit. He wished that a corporation would be set up to be able to receive endowments, gifts, and bequests. The trustees got to work immediately. They knew, though, that in order to keep the hospital financially secure, they must engage the community for support. If the community wanted a hospital, they must provide the furnishings. On September 4, 1936, an article came out in the Baldwin Bulletin stating that success of the hospital depends on cooperation of the citizens of Baldwin. At the time, a group of 48 women formed the Hospital Guild, now known as the Auxiliary.
And so at the very first meeting, there were 48 members signed up to become members. And they elected a president and the officers. Then they called another meeting just a little later and put an ad in the paper that they would like country people to also join this guild instead of just the town people. And at that meeting there were 82 joined at that time. And they set the dues at 15 cents a month. So the members then started making tearing up rags to have rugs woven for the hospital, for the floors. They made draperies. Yeah, then they started rolling bandages and making cotton swabs, draw sheets. These were all made by the members of the auxiliary.
We had a ladies' auxiliary that contributed lots of things, you know, and you said 30s and 40s. We have the auxiliary would make bandages and can vegetables and fruit for the dietary department. All that, and that was really a community involvement.
Oh, the auxiliary was a tireless bunch of ladies that just did a lot of work for the hospital. They didn't, when I came here, they didn't do patient care or help on the floor or anything like that. But they worked very hard making money to buy equipment and supplies for the hospital.
In addition to the Hospital Guild, there were many contributors to the hospital, including the schools, churches, and the American Legion. The Baldwin Boosters organized a community drive to fund the hospital. Finally, the community came together, and on December 18, 1936, the open house was held. The building in 1936 was a 52 by 36 foot structure with 2 stories. It included a 15-bed hospital, complete with a delivery room, nursery, operating room, and a kitchen. The total cost of the building was $18,026.84. In addition to the hospital, the community of Baldwin had also built a new school. These projects gave the community a feeling of renewed strength as a surviving town when so many other towns had failed after the Great Depression. The hospital was not without a patient either. The first patient was Anton Lucken, who had broken his leg. He remained in the hospital for 6 weeks before being discharged. By January 8th, they had a grand total of 13 admissions, including 3 new babies. The 2 physicians in the area were Dr. B. Cunney and Dr. C.A. Olson. Together, they formed the hospital's first medical staff.
I came in the 50s time when the second edition came on, and Dr. Olson was here, and of course he was just a great gentleman with a wonderful bedside manner, and we all loved Dr. Olson, and of course his wife Midge and their family, and they lived right across the street, so that was always handy.
I think his patients loved him dearly. He had a way of connecting with his patients where he would give them all the time in the world that they could ask questions, and he would explain exactly what they were doing. He'd always sit down next to them and pat their hand and say, you know, everything's going to be okay. We'll take good care of you, and you believe every word he said.
The staff also included a day nurse, a night nurse, a cook, and an assistant. Joe Fellinger was the first nursing director.
She was a jack of all trades here in the beginning. People tell me that she did the anesthesia in the OR, and she did the supervision, and she probably was here 24 hours.
I did know Joe Fellinger,
Okay.
and I didn't hear stories about her in particular. I do know some of the early things about the hospital as far as how it ran and stuff, because my mother worked here, and she worked in the kitchen, but there was no elevator in the first building, and so when it was time to feed patients, they would have to take the trays upstairs by hand and carry the trays back downstairs again.
Now, by 1952, it became apparent that the present hospital building had outgrown the needs of the community. A new addition was needed, and the total cost was $135,000. It was the goal to raise $60,000 from the community. A group of 50 men offered to solicit every home for pledges or donations. This proved to be successful because on July 14, 1952, ground was broken for a new addition. The addition included X-ray services, a new entrance, as well as 17 new patient rooms. The construction was completed in 1954. During this time, it was decided that a new clinic would be built next to the hospital. This would be an advantage because the physicians would be close by and parking facilities would be better. A new building was constructed on Curtis Street in 1958. As a new decade approached, Baldwin Hospital was again stretched beyond capacity. Even with all the latest technology of the time, it was apparent that another renovation needed to be done in order to meet the needs of the community. Again, another community campaign was started to raise funds for the needed construction. The total cost of the construction was $480,000. This community campaign was again successful, as $281,000 was raised. In November 1971, the building construction was complete.
I was still a student at the time, and I was assigned to move all the patients over to the new area and decide which room they were going to go in. So the director of nurses told me, Jean, you just do that, come in extra. So I would have to load up all the stuff, put the patient in a wheelchair, and then push them over to their new bed. And it was kind of an exciting time because I'd watched the building being constructed all those years before that. During the construction period, there was a lot of noise, a lot of dust, a lot of apologies. It was hard, but like I said, we were so busy and so appreciative of having that opportunity to grow in 1970 and have that new building.
In 1978 came a crisis situation for the hospital. The state of Wisconsin Division of Health Code required that surgery and central supply must be in a fireproof structure.
The state told us that it was time that we needed to revamp a lot of what we had, and so it didn't meet code and the laws and rules and things.
Since the surgery unit in the original 1936 building was constructed in a wood frame, the surgery must be relocated. The community again came together and approved an expansion of the building. On March 26, 1979, groundbreaking began. Construction was complete in 1980.
They had published it in the paper that there would be a meeting because the hospital was having problems, you know, should they build or shouldn't they build onto the hospital. And over 400 people came to that meeting, and it was just unanimous, yes, you know, we must.
There were some things that I wanted to make sure that we had, and that was so much bigger, a bigger area to work in the OR. And so we made it a 20 by 20 instead of a, I don't know, probably 16 by 18 room. And it's very interesting because we just thought it was huge, and we were thrilled to have a larger operating room. And the supplies and everything were just right at hand there. And we had a central supply that we could put our sterile supplies in, where up in the operating room in the 1936 edition, or building, the operating supplies were all in a little closet. The sterile supplies were put in a little closet, and it would be smaller than a closet in a house.
In the early 1990s, the Board of Trustees realized that inpatient care would no longer be the way of the future. The facility that the community had worked so hard on was no longer meeting the community needs. It was decided to add a new $3 million addition to the north side of the facility. The addition was complete in 1995, which included a new entry and waiting area, physical therapy, occupational therapy, cardiac rehabilitation, conference room, laboratory, emergency department, remodeled outpatient services area, as well as an intensive care unit on the second floor. In 1995 and 1996, Baldwin Hospital won the Top 100 Hospital in the Nation award.
Medicare would take all of the hospitals that they had certified, and then they would take their numbers, patient care numbers in different categories, and then crunch them all together, and then they would rate them. And we wound up those 2 years as being one of the top 100 hospitals to be rated in all those categories. That was exciting, though. We had, you know, even though the first year we just kind of got it, we didn't realize it. The second year was even more exciting for us because we did it 2 years in a row. We were trying to get 3, but we didn't make that.
The fifth major renovation included a 32 exam room clinic, new OB wing, fitness center, a therapeutic pool, and renovations to radiology. With this construction, the two organizations, Baldwin Clinic and Baldwin Hospital, became Baldwin Area Medical Center. Hi, I'm Allison Page, CEO at Baldwin Area Medical Center. As you've heard from the many people who have shared their stories, we're very proud of our past. We're equally as excited about our future. Together, the Board of Trustees, the medical staff, and the employees of Baldwin Area Medical Center pledge to continue Mr. Bergsling's legacy by providing exceptional health care to the people of Baldwin and the surrounding area for generations to come.
Yes, we had a lot of camaraderie, and that's why the hospital really, I think, maintained itself, was because of the people who worked here. We used to call it our at-home hospital because it was right here in the area.
One of the reasons I love working here is the people that I work with. I think that I've developed my closest friendships with the people I work with. I have a lot of confidence that they're giving good quality care every day. So I can be proud of what's happening here at Baldwin.
You know, I really think the village of Baldwin is the best place to live. Everybody seems to be happy. They all get along.
I think the biggest thing the community's ever done, at least in my time here, was support those building programs. When we went to them and said, would you agree if we do this? And they said, yes, do it, we need it.